Hello everybody, my name is Chris Hund and welcome to the TeamSTEPPS for Office-Based Care online webinar on TeamSTEPPS training and implementation. I'm Director of the National Implementation of TeamSTEPPS and I work for the Health Research and Educational Trust of the American Hospital Association. This webinar is part of a library to support all of your work on the TeamSTEPPS for Office-Based Care online course. The webinar, along with the other webinars, are part of a program, and they will be useful for you in getting your Master Trainer designation at the end of the TeamSTEPPS for Office-Based Care online work that you're doing. This is all funded by the Agency for Healthcare Research and Quality, which is a part of the Department of Health and Human Services. So thank you for that funding, as well as for all of the other TeamSTEPPS work that's being done. It's very appreciated that AHRQ is moving the ball forward in the patient safety and quality improvement field through teamwork and communication. So on today's webinar, we have two presenters, and I'll be turning it over to them in a second. Both of them are from the University of Iowa Health System. We have Michelle Turner, who's nurse manager at the UIHC Iowa River Landing facility, and she's the co-project lead for TeamSTEPPS. And with her is the other co-project lead, Kip Peterson, who's manager of the frontline operations at the Iowa River Landing Center. So without any further ado, I am going to pass it over to Kip and Michelle.
Great, thank you so much, Chris. We thought we'd start out by giving you a background of Iowa River Landing. We feel like we have a very unique setting, so I think it's helpful to explain it to you and what we came back from our master training, what our building layout is like. So the picture on the left is actually the University of Iowa Hospitals and Clinics. It's located in downtown Iowa City. The University of Iowa Hospital is an 800-bed, world-class academic-level hospital. It's Iowa's only comprehensive tertiary clinic and level 1 trauma center. And the university actually employs about 9,000 employees. So Iowa City is not a huge place. It's one of the biggest employers in Iowa City. So on the right is our building. This is Iowa River Landing. This is where Kip and I work. Iowa River Landing is a 5-story off-site ambulatory facility that was actually designed to decompress outpatient visits at the University of Iowa. So Iowa River Landing has a very convenient location. We have free parking. We offer the same world-class care as the University of Iowa does, the same multi-specialty clinics. In fact, we have over 20 different specialty clinics, also including a procedural sedation suite. We have pharmacy, lab, and multiple other services. So our building actually has multiple cultures within one culture. Some of our clinics only have one nurse and just a couple of medical assistants, a small number of support staff, where other clinics that we have 7 or 8 nurses, 20 medical assistants. We have clinic pharmacists, social workers, and many other support staff. So we feel like for those of you that are listening, I think we can probably identify with many of you and the sizes of your clinics. We have varying hours, and we're going to discuss kind of how we planned and implemented TeamSTEPPS in our unique environment and how we customized our program based on the individual areas that we are working with.
Thanks, Michelle. So today I will go over today's objectives. First is planning for TeamSTEPPS implementation. I'll be covering this topic at a higher level, but if you're interested in learning more about this in depth, I would encourage you to watch our first webinar on planning and assessing, where we go in great detail on this piece. The next one that I'll be covering today with Michelle is the training options, specifically master training and how to identify TeamSTEPPS tools and how to implement, as well as how to create a fun, interactive training approach. The next is going to be implementation and what to do after you have implemented the concepts and tools of TeamSTEPPS. And lastly is maintaining and sustaining. Our future third webinar will go in more depth about maintaining and sustaining, so we'll talk briefly about this today, but things to consider as you're doing the implementation process.
And we like to start with this slide. We've utilized this in all of our classes that we roll out. We feel it's really important to define TeamSTEPPS, what our mission and our vision are, and then the hope for each team and what they'll get out of TeamSTEPPS. So we start our sessions with this slide, giving the textbook definition of TeamSTEPPS, then followed by the 4 team concepts that we hope to gain: knowledge, empowerment, attitude, and performance. And one thing that we do is we ask each staff to leave their name tags at the door to symbolize the importance of that titles don't matter and everyone is on the same page, everyone's voice needs to be heard, and that all staff are equal.
All right, so planning for implementation. First is going to be defining your scope. So what is your ultimate goal? You may have this defined for you by your upper administration or management team, or you may be asked yourself to define your own project plan. We both would strongly encourage you to look for a quick win. Look for a department or a team that is a high functioning and great cohesiveness. We do want to warn you that it is normal that a manager or administration may suggest starting with a really difficult clinic first, but please avoid, if at all possible. We have found great success in gaining early momentum before starting with a difficult group. So for us, we started with a couple of different really high-performing teams, and we kind of got this momentum, the ball rolling a little bit, which created a great excitement within our building. The next thing you'll want to do is identify your champions. So look for the core, what is important to you? What core characteristics are you looking for? For Michelle and I, we're looking for people that embrace change well, viewed by others as positive leaders, and have a positive outlook on their culture. These are going to be your change agents. They'll represent you on the floor, even in times of stress. Next is generate excitement. Power of positivity is so important when rolling out a new initiative. We celebrate the invitation, and Michelle and I will go in person if at all possible and talk to the staff in person so that we have that mutual understanding of what is our goal, what are they going to do to help us roll this out. And last but certainly not least is provider buy-in. This is an absolute must. This is something that Michelle and I have unfortunately had to learn along the way. The most successful departments we've rolled out TeamSTEPPS with has had great provider buy-in. To do this, we strongly encourage you to meet with the provider in person. You want to sell TeamSTEPPS, what their role in your team is going to be, and make sure you get their buy-in and support. And then if you don't get provider buy-in, one of the things that we've seen is that staff, so your clinical support staff, your frontline staff, often will speak up and say, hey, let's get some providers in this so that they understand the different tools that you're sharing with us, so that when we speak about them in clinic, they have a full knowledge of what's going on.
So there's several logistics to consider as you roll out or plan the implementation of TeamSTEPPS. The first one that we considered is time. Time is adaptable depending on the group that you're working with and the commitment that you have from your administration. So factors to consider are, paid lunches. Are you willing to pay staff for lunches, pay overtime for before, after business hours, and also having to close clinic slots to be able to do this. So, we've found actually for us, what's most successful is to schedule a 90-minute time period. So we say once a month, 60 to 90 minutes, but our most successful classes have been 90 minutes. We find that that things don't always start on time, and we feel like sometimes people need to leave a little bit early. So having that 90-minute window broken up into 5 classes once a month over the course of 5 months has worked best for us in our setting. Later in the presentation, we'll discuss how we have broken the TeamSTEPPS into 5 different courses from the material that we obtained at the master training courses. It's important to schedule the meetings in advance and commit to those times. So like Kip said, we send an invitation that it's a very professional and kind of celebratory email that says, congratulations, you've been chosen to participate in TeamSTEPPS. We also personally round with each of the teams just so that we can articulate what our goal, mission, and vision are for the program. And then we follow up by making sure that we have Outlook calendars to all team members and providers for all upcoming meetings so that they can plan accordingly. The next factor to consider is your environment. It's vital for people to have the very best possible learning environment and to be sure that it's secured for all your upcoming meetings. So we have a large conference room in our building, and we make sure that we can schedule all of our times in this conference room because it gives us the opportunity to break the teams up into tables, be able to move around when we're doing team building activities, and have room if we need to serve lunches or have donuts or something in the morning. So, and like I said, we set the groups up by tables. Staff are seated when they first come in, but Kip and I pay very close attention to where they sit, and most often they will sit with their friends or kind of their cliques, groups that they're usually with in the clinic. So our very first activity, we normally number them off and break up the cliques. We do this and found that this is the most successful way of assuring that people step outside their comfort zones and mingle with those that they may not routinely interact with to create a more cohesive team dynamic. Other considerations that we consider are what concepts and tools to pull out of our TeamSTEPPS toolkit. So Kip and I spend a lot of time doing our homework on the clinic and the planning phase prior to implementation. We don't have a cookie-cutter approach. We customize the program based on clinic needs, what the clinic culture is, what issues are identified, whether that be workflow or relationship issues, other factors that we may identify by doing clinic observations, rounding through the clinic. We also send out a pre-survey questionnaire to the team, which really focuses on how they would rate their current culture. And in our last webinar, we discussed silent brainstorming. We find this to be one of the most incredibly effective tools to utilize in order to help identify areas of opportunity in each clinic. The way we do this is we meet with the group and we ask them a series of questions and we have 6 different colored Post-it notes on the table. So an example of a question we may ask is, what's the biggest waste of time you find in your current workflow? Or what may make you want to leave a job? And so staff jot down what those things are, and then each staff, it's all anonymous. Then Kip and I will gather the responses, mix them up, and divide them back out into the teams. The teams then divide those answers into categories, so workflow or culture. This gives us a really good idea of the direction to go with that particular team. Typically there's a theme that's identified, such as medical assistants not feeling respected by nurses, or lack of communication between the front line and the nursing staff, or uncomfortableness having difficult conversations. And so then Kip and I can really tailor our presentation to focus on and identify those issues. And lastly, we have a very close-knit management group that meets weekly. We discuss issues in clinics with the immediate supervisors and what issues they would like us to focus on and what tools they feel would best be utilized in their clinic.
Thanks, Michelle. Just, if I may, I have a couple quick questions.
Sure.
So it sounds like you do a lot of things ahead of time with the questionnaires. You guys go in and observe. You have people maybe do the silent brainstorming activity. Do you have any other sort of pre-work or pre-reading that you give people? Do you have them see a little bit about what the tools are ahead of time?
We do often. So we do a few things that are outside of the toolkit that I think Kip discusses later down the line. We utilize the DISC assessment. So we have them do some pre-work as far as figuring out what their personality or behavior type is. We have them read the book Our Iceberg is Melting. So that's some pre-work. And we'll often send them out some tools and PowerPoints prior to, just so they can see what's coming up. So we do give them a little bit of work. We know within that 60 to 90 minutes we have a fairly limited span of time, and so we do give them a little bit of homework sometimes.
Sounds good. Yeah, and that 60 to 90 minutes sounds like it really works for you. I just wanted to let everybody know that some clinics might shut down even for a whole day if that's what's feasible for them, and then others make it a lot shorter, and they might just do quick hits and 10 to 20 minutes on one concept at the end of the day or over lunchtime for people or at a shift change. So it's really something that's, I think, best, what works best for your situation. So thanks.
So I'd like to talk to you a little bit today about how to make TeamSTEPPS not just another initiative. So how to avoid this mindset. TeamSTEPPS is now a way of life for us at IRL, but it's important to distinguish early on the difference between an initiative and expectation. What we've done is our first important step is for our project lead and master trainers must consistently live the TeamSTEPPS approach. So what we mean by that is be someone that's positive, approachable, and willing to spend the time to train on the core concepts of TeamSTEPPS. We want to make sure that we're celebrating staff when they use different tools to promote services. So maybe you get an email that somebody put in SBAR. We celebrate that. Or if we have a good catch award in the clinic, we celebrate it as a building. What this does is it helps promote positive reinforcement. The next thing we do is we embrace opportunities to improve and use it as a learning experience for our team. So maybe a situation didn't go so great, so we debrief it. We break it down, and then we talk about what could we have used from TeamSTEPPS to make this thing different for future examples that may come up. So we really embrace those opportunities. Don't beat yourself up over it, but use it as an opportunity to improve so that it doesn't happen into the future. The next thing, and you're going to hear us talk a lot about this, but we really want, and we've created this here at IRL, we try and create as much excitement and a buzz about TeamSTEPPS as we possibly can. So what we look for is we look for high traffic employee areas. At IRL, we're kind of fortunate because we have on-stage and off-stage facility build. So the kind of things that we do is we have a monthly town hall meeting that either Michelle or I or members that have gone through TeamSTEPPS will present on different tools, different examples, upcoming presentations. And what we've found that people would rather hear from the medical assistants or the nurses or the frontline staff, the people that are affected by this program, and see how they're selling it as opposed to always hearing it from upper administration or management. It's much more empowering, and we've had great success with this. Another thing that we'll do is we call them potty pushers, but we use signs like the picture on your screen now on the lower right-hand corner. We call them potty pushers. We put them in all of our employee restrooms, and so we'll put upcoming events, patient feedback. There is always a TeamSTEPPS tool or a TeamSTEPPS update on this, and so we're constantly putting out information each month, each week. Whenever we deem appropriate, we can update these signs and make sure that people have the most up-to-date information. We also take advantage of our employee elevators. So we'll put signs in our employee elevators, again, talking about TeamSTEPPS tools or upcoming events or upcoming meetings. It's constantly in the face of our staff so that staff always have the most up-to-date information. And then lastly, we just started this last month, but we started a thing that we call TeamSTEPPS Tool of the Month. So our first tool of the month last month was SBAR. We presented at our town hall meeting. And then we've challenged everybody, if you're bringing a concern, whether it be an email or in person, to put it in an SBAR format, so just so that people get the practice of using it and working through that different scenario.
Kip, I could see how this is something that really garners a lot of excitement around the whole building. Since you have people that might not have gone through training yet, but are seeing these things in the elevators or in the restrooms, does that generate excitement with them as well? Do they come to you and say, oh, when are we next?
We get that all the time, and we get it. We just had our yearly reviews, and we had tons of those kind of comments coming at our yearly reviews. And that was, like Michelle talked earlier about how we have so many clinics and different cultures within one building. We thought doing a TeamSTEPPS Tool of the Month would be a great way to get the tools out to everybody so that as we get to those departments and try to roll out TeamSTEPPS, that they're already familiar with the tools and the concepts and different ways that they can use them. Yeah.
Yeah, that's really great. Thanks.
You're welcome.
So we're going to talk a little bit about training options. So master training, I think, can mean something different to every organization. To us, Kip and I attended the master training course last year in Minneapolis. When we returned, we chose that we made the decision that we were going to be the only master trainers at this time in our organization. So we sat down and we produced our program by utilizing the information that we had obtained from the master training. This is when we put together kind of our 5-step program and how we were going to do this. So we teach this as a series of courses. The idea is not that when the clinic staff are done with this, they become themselves master trainers, but they now have and understand the tools and concepts of TeamSTEPPS, and they can be our change agents, or we like to call them our super users, in order to be representatives of TeamSTEPPS in our efforts to create a positive shift in culture. So they are advocates, coaches, mentors to new clinics that begin the implementation of TeamSTEPPS. So kind of our generators of excitement too. So as master trainers, Kip and I feel like it's important to have a plan not only for implementation, but also for sustainment. And as Kip discussed, it's possible that your leadership may want you to start with kind of a clinic that may have some dysfunction when you return from master training, or however it is that you get master training. And we really can't emphasize enough how important it is to identify that area that will be your quick win, because once you have that clinic that's utilizing TeamSTEPPS concepts and tools, and they're a high-functioning clinic, this helps sell the program to teams that may have more resistance and barriers. And then as you have more excitement and people have a little more buy-in, I think it's easier to kind of overcome those barriers. So it is important, talking about barriers, to anticipate them and have a plan for how you're going to deal with them. Some of the barriers that we have found are staff resistance to change, scheduling conflicts. Some institutions may have financial conflicts. Obviously, this is a commitment that your institution has to make. Other barriers are inability for providers and staff to be able to leave the clinic. So if they have a patient that got added on, or a sicker patient in the clinic, and not being able to come, and then just people not buying into the program. So really anticipating and knowing how you're going to deal with some of those barriers and challenges proactively is vital. And then lastly, as being the master trainers in the building, we had to discuss what our measurables will be. So we utilize surveys that are provided by TeamSTEPPS, and we formatted them into an electronic version using a system that we have at the university called Qualtrics. And that takes the pre and the post surveys and puts them into a nice format, a reporting format, that we can provide our leadership and management teams, because it's important to be able to continue to show them the progress that we're making so that they can continue to support the program.
Thanks, Michelle. I think that it's important to know that there are a lot of different ways that people could go across about master training, like you said. people become master trainers like you did through the National Implementation Program in person at one of the regional training centers that are sponsored by the Agency for Healthcare Research and Quality. People can become master trainers online, which if you're listening to this webinar right now, you are probably in process of becoming a master trainer through the TeamSTEPPS for Office-Based Care online course, or you can make other master trainers. If you've become a master trainer, you have the power and the ability to make new master trainers to help you out. But not everybody needs to be a master trainer. In fact, it's very wise to have a smaller number of master trainers and to instead focus people on other parts and other roles. And so Michelle just talked about super users and champions, and it's important to have people like that and people who are coaches, and to know that being a teacher and being a coach is a very different thing. So just wanted to interject that really quickly here as we're moving forward.
Yeah, thanks, Chris. That's a great point. So I'm going to talk a little bit about fundamental concepts. So the approach that Michelle and I took early on was we are instilling a bite-sized chunk pieces of TeamSTEPPS based on the departmental needs. So at IRL, our approach is always to have our first meeting to create and build a strong team foundation. So what we've done is we've created a 90-minute presentation that's very fun, interactive, and generates tons of excitement. We do this to help us identify our current team cohesiveness and to see how we can build upon that. So like Michelle said earlier, this first meeting really kicks off and gives us early signs on where we should direct the TeamSTEPPS concepts and tools and how we can customize our approach based off the departmental needs. And how we do this is we have different activities. And so some of the different activities that we do is we build bridges. And so we'll break teams off into teams of 4. We'll give them a big stack of newspapers, and then we'll say, okay, we're going to give you 10 minutes. You have to build a newspaper bridge with using only newspaper and masking tape that has to hold an object of some sort. And so it's pretty fun to see all the interaction and the competitiveness that quickly comes about. And what this does is it teaches them how to work together as a team, how to communicate. We take the same approach with making chains. You're probably familiar with this. In the master training course that we took in Minneapolis, we built chains. So this is your old, kind of the old school model of construction tape or construction paper, and you make paper chains. And then lastly, we do have a library at IRL where we have the book Our Iceberg is Melting, and we ask staff to read this prior to kicking off TeamSTEPPS to help give them a general idea of the different concepts and approaches that we're going to be talking about. The next thing that we've found very empowering is we ask staff to talk about what they look for in a team, a mentor, and a peer. And we have them write down on large Post-it notes similar to what you see on your screen on the lower left-hand corner. And we have found it to be extremely powerful to do this and have the staff actually write down what they look for. And what we do with these large Post-it notes is we tear them off and we go to their work area and we place these strategically in their work areas so that they're always walking by these signs, reminding them the importance of teamwork, togetherness, how to be a good coworker, how to be a good peer. And then we've found this to be extremely powerful as we continue to roll out TeamSTEPPS.
So we're going to talk a little bit about the tools that we utilize in the next few slides. We've talked a lot about taking the step-by-step approach and how we do that. We found that the best tool to start out with is situational awareness. We talk about the importance of removing your binders and seeing what's going on around you. So really teaching the team the 4 elements of the STEP process, which is knowing what the status of the patient is, knowing what the status of your team members are, what your environmental conditions are, and the current progress towards your goal. We find that it's vital for the team to begin to identify what's going on around them from the very beginning and being able to identify, process, and comprehend the elements of information that's related to situational awareness. We use real-life examples of situational awareness issues or problems. For example, our clinics are set up where we have a larger workroom with like 4 different pods or groups of teams. So you may have 4 providers in a room with their sets of medical assistants and nursing, and all 4 groups are seeing their own groups of patients. But often we see where one group is working really, really hard, they've got maybe more patients, and another group is working on refills and not always aware of what's going on around them. We use examples of where a pod has had an unstable patient and another group hasn't even known that they have that. So talking about, real situations that happen in clinics, and those situations and how we can better deal with those. So we do a lot of on-the-spot discussion, huddling, and debriefing about situational awareness and having them identify situations. Activities that we like to use, so there's several videos out there on YouTube or different avenues on the internet. One that we really like to use is the monkey business illustration or the whodunit video. Both of these videos really teach situational awareness and paying attention, knowing what's going on around you. We also use the 2-in-1 illustrations where I'm sure everyone's seen where one person may look at a picture and see one thing, and then another person sees a different picture. So we really talk about the example of how people see things differently and the different perceptions people have of the exact same situation. We also use a lot of real-life scenarios and acting them out in front of the group and then debriefing that. And we find that having the teams act out scenarios and discuss them and what a better option would have been is a very powerful way for people to learn what the tools are.
The next thing we want to talk to you about is effective communication in difficult conversations. Michelle and I found out early on when implementing TeamSTEPPS that we really needed to give staff the tools to how to effectively communicate and the importance of having these conversations before just giving them the TeamSTEPPS tools. And so we spend a good portion of time on the fundamentals of how to have that effective communication. We talk about the fundamental tools and the importance of doing so in a timely manner. We really strongly encourage to be brave enough to have a conversation that matters, care enough about your peer to talk to them in person as opposed to ignoring the situation and sweeping it under the rug, or even worse, just going directly to your superior or your boss's boss to bring a situation. It means much more if you have that one-on-one conversation as opposed to any other way. The next thing that we've done is we've done DISC assessment. So a DISC assessment, if you're unaware what this is, it's a behavioral and personality assessment that, again, you can do online. It's free. Michelle and I are not certified in DISC, but we are sponsored by somebody at the university that is. And so that person has actually come to our IR River Landing several times now and done DISC assessments with a team. What's great about this is that it helps everybody understand the different behaviors and personality traits that we all have. And so one of the activities that we do within this is we do what is your perception. So for me, I would have to guess what Michelle is, and in return, Michelle would have to guess what I am. And then we share our results. And so each individual employee on our team knows what we're perceived as and then what the actual reality of what my behavior or personality traits are. And why we think this is so important is because it will help everyone have a better understanding on how they can effectively communicate with different personalities and also understand how those different personalities are going to communicate with us. And then activities that go along with effective communication. So we do some very basic one-on-one conversations. So we'll break teams up into one-on-ones, and we'll ask them just spend 2 minutes talking about your favorite vacation or what you did this weekend. And what we're looking to gain out of this is just, again, your basic fundamentals. So body language, eye contact, asking questions to continue the conversation to go on. We found this very important just so that we can show how important the basic fundamentals are when having an effective communication. Another thing that Michelle and I like to do is we like to play what we call a word game. And so you have a series of questions that you'll ask groups of 4. And the challenge is they can only give you a one-word answer. What we like about this is it teaches the team how to compromise and how to effectively communicate with each other to have one answer, which oftentimes is very difficult, but it's fun to see teams think about how they're going to come up with just one answer to some very difficult questions. And then the last thing that we thought was really fun was a picture of Michelle and I on the lower right-hand corner. This is what we call the drawing game. And so Michelle and I are back to back, and I am trying to describe to her how to draw this figure that's on the presentation. But Michelle can't look at it. She just has to take my word for it. And so what this does is you're essentially creating your own personal barriers on how to draw this, and it teaches people how to adjust and how to effectively communicate with one another. At the same time, it's a lot of fun, and it creates a lot of laughter in our presentation.
So the next kind of group of tools that we go to in our toolkit, we call our TeamSTEPPS 101 tools. And these are core tools that all of our groups, we roll out with all of our groups. And like we discussed before, we work really closely with our leadership just to see, what tools to kind of start with and how to group those. And this helps us to really customize the program for each individual area, depending on what the clinic need is. So huddling and debriefing is something that I think we kind of already had started at Iowa River Landing, and so it is something that we work with each of our groups and talk about huddling. What does huddling look like for your particular clinic? I mean, we have clinics that have just a handful of staff, like I said, versus some that have, up to 40 different staff members. So like with our procedure unit, they implemented a great huddling system. They huddle exactly the same time every morning. They have a huddle sheet that they go through, and they make it very efficient. They also do the exact same thing in the afternoon, and they debrief with their debriefing sheet, and they go through each individual piece on the debriefing sheet. And they've really done a great job with implementing huddling and debriefing. So when we discuss this with teams, what huddling and debriefing is, we give them some homework to follow up with. So we ask them, what does huddling look like for you? And we have them kind of pilot how they want to do huddling. We have a couple clinics in the building that have wanted to utilize huddle boards, and so whiteboards, and that's something that we haven't yet started, but a couple of our recent groups want to do huddle boards. And so we really give the ownership to them and ask them how they want to do it, because if it's something that they decided and they came up with, the buy-in is going to be so much greater, and they're going to own it and really want to do it. So that's kind of one of the first tool steps that we use. And then for the next 3 tools, SBAR, CUS, and the desk. These are 3 concepts that we kind of loop together into one presentation. And the reason we do this is we feel that they all can kind of intertwine. We define each of the different tools, and we show a video for each of the tools. And then the last part of that actual class that we do, we bring real life scenarios and we role play. So we may give them a situation like a patient's late to an appointment, the frontline staff calls back, the nurse is annoyed because she knows that there's no clinics or there's no space to add a patient on, and gets short with frontline and then hangs up. So we ask them to identify which TeamSTEPPS tool they would use and what that conversation would look like. And we actually have them get up and in front of the class and act it out. And then as a group, we debrief that and, ask them are there other tools that they would use. And so we've found that to be an effective way to teach the SBAR, CUS, and DESK.
Quick question here, if I may, Michelle. So it seems, like these particular tools really work for your, first tools out because of the culture that you have at IRL. But have you found teaching CUS and DESK a little bit difficult, because they're the types of tools that, for lack of a better word, they're used in challenging situations. So I was curious how your people have reacted to them, especially since they're some of the first tools you're teaching.
That's a great question, Chris. And one of the things that we do, especially with CUS and DESK, that we have found to be extremely effective is that it goes back to our previous slides where we talk about make sure you do your homework before you implement with that department. One is know who your champions are within your own department, because if you're not getting a lot of volunteers to come out and do role playing, you can really lean on those people to come forward and be kind of your role-playing superstars, so to speak. And then the second part of that is, with CUS and DESK being more sensitive, we have found that if you have real-life examples that they can really relate to, and they can be like, oh yeah, I can remember when that happened to us, or something similar to that has happened to us in the past, they have a lot more compassion about it, and they take it a lot more serious, and they want to learn how they can continue to get better and how to address those for future.
Thanks, Kip. That makes a lot of sense to me.
The next one is going to be implementation, and we thought it was helpful to share with you our ground rules. So Michelle showed you the slide from earlier about the slide that we always have about TeamSTEPPS. This is always the slide that's afterwards, and one of the things that Michelle talked about was showing respect for everyone. So one of the things that we do when our staff come into the room is we ask them to take off their name badge. We want to remove all titles aside when they walk into our room. The next thing that's extremely important is to try your best to stay and end on time. And we ask staff to put their personal cell phones on silent so they don't interrupt any important conversations that we have. We try our best to create an environment where people feel comfortable asking questions, even if to them it may come across as maybe a dumb question. There are no dumb questions, especially when you're trying to implement something that's as important as TeamSTEPPS. Do not leave in silent disagreement is, Michelle and I, one of our favorite ones, because what this essentially means is we know that not everyone is going to buy into a concept or an approach with TeamSTEPPS, but what we have challenged everybody with is we don't want them to go back to the floor or back to their work environment and immediately start talking negative about the concept or about the approach. If they have questions or concerns, we challenge them, come talk to us one-on-one so that we can explain maybe further or maybe change our communication style on what we're trying to implement. Because the last thing you want is you don't want staff to go to the floor and to have maybe a negative light on something that you're trying to implement. We call it a writing holiday because we do write on the big giant pieces of Post-it notes to put in our clinic. And then lastly is most important, have fun with it. It's okay to laugh and come up with some funny activities. It really breaks the ice and creates a fun learning environment.
So we've talked a little bit about how Kip and I really focus on using a step-by-step approach and really instilling the bite-sized pieces of TeamSTEPPS based on departmental needs so that we're not overwhelming people with information, but we're giving them really small pieces of TeamSTEPPS that really leave them wanting to come back for more. So this is kind of a basic idea of how we have broken our program up into different steps. So in step one, we always start out doing a team building activity, and then we define the current state. So this is where we do the silent brainstorming, defining, what culture means to them. One thing we have had them come up with definitions of what culture means, and then we have that up on a slide each of the rest of the steps as we go through them, because we've said this is what you've identified as culture, and then what culture means to us. Step 2, we always talk about situational awareness and effective communication. Sometimes we will do a little bit of difficult conversations along with the effective communication just to discuss the difference. But we focus a lot on difficult conversations and the DISC assessment, personality types, how to speak to people in our 3rd step. And we find that this is one that people really get into. I mean, being able to know how to speak to someone that maybe hears things one way and is very important. I think this is one we found our staff enjoy. And then our 4th step is we talk about the S-bar, CUS, and the desk. And the last step, we do a summary or wrap-up. So this is usually a fun kind of wrap-up of everything we've done. And then we have a TeamSTEPPS Jeopardy game that we play that is a review of absolutely every element of TeamSTEPPS that we've talked about, asking them questions and kind of making it a lighthearted, but yet it's a very strong review of TeamSTEPPS.
So what happens after implementation? So the first thing that we do is a post-implementation survey. We get honest feedback and see how effective we've been. There's 2 very specific questions that Michelle and I have added to the TeamSTEPPS questionnaires. One is, I feel more confident speaking up when I'm concerned for patient safety after completing TeamSTEPPS. And the second one is, I have used TeamSTEPPS tools and concepts to address issues that have come up in my work environment. These are really kind of the measuring sticks that we're looking to gain. And we do ask staff to be extremely honest, because if we're not seeing much change in these questions, we need to do some things differently in our approach and probably see what we can do differently with that specific department on how we can be more effective. The next thing that we do is schedule follow-up meetings, and so this is really kind of early for us because we're still putting together a sustainability plan at IRL, and we're going to talk about this in much more detail in our 3rd webinar coming up here soon. So I won't go into too much detail, but these are the things where we're going to continue to address real-life clinic issues, make sure that we're celebrating successes, and continue with ongoing coaching and mentoring. And lastly, we created a certification of completion, which you can see in the bottom right-hand corner of your screen. We think it's extremely important that these staff members have put so much time and effort in implementing something that we think is so important. We want to recognize their success and give them something that they can feel and touch. And so we give them these certifications, and it's really cool because they do hang them up in their workspaces, and it's something that they're very proud of, as we are too.
And just to kind of continue, this is kind of our current state right now is what happens after implementation. We, like Kip said, we work hard to generate excitement and to celebrate the teams that have completed successfully. We have a monthly town hall meeting in our building where all people in the building, it's a big potluck, and they come. We do it in 2 different sessions. We talk about where we are with TeamSTEPPS. If we have staff members that are willing to come up and speak in front, and this has been very successful for us, is a group of the team that has just gone through TeamSTEPPS will say what TeamSTEPPS means to them. We also have an employee recognition board, so we will put up the teams that have gone through TeamSTEPPS. We feel like it's really important to identify the champions that have gone through TeamSTEPPS. Kip spoke about before, really picking the people that embrace change, those people that are positive, they're the change makers, because they are really representing what our mission is. And we want people to feel like this is absolutely what our culture, we want to live it, breathe it. It's not going to be the next best thing or the next program of the month. We really want to make sure that people know this is not going away, and it's important to our culture. And then lastly, we are expanding the knowledge to our management team. So during our weekly management, our medical director has a portion that he lets Kip and I talk about TeamSTEPPS. where we're at with TeamSTEPPS, and then just continuing to give them education and knowledge so they can also be champions of change. And we've sent additional staff members to the master training that are on our management team and are going to continue to do that until our management team has all gone through the master training. And they will be part of our sustainability plan, as we will discuss in our next webinar that we have.
So wrapping up, I want to talk to you a little bit about lessons learned that Michelle and I have found very important along the way. So first and foremost, know your scope and what your end goal is. So develop and roll out a plan to implement, identify your change agents, and make sure you get provider buy-in. This is so important for the long-term success of your program. Know your audience. Make sure you do your homework and anticipate your departmental and staff needs and opportunities for a quick win. And if at all possible, try to get your quick wins with your department and your teams before kind of diving in with a difficult group or department, because that will create momentum for the whole program itself. The next one is make training fun. This is a great opportunity that you can interact with staff. One of the general rules that we have for our presentations is that we don't go more than 10 minutes or more than 3 PowerPoint slides without having some kind of interaction or an activity. What we found is that this keeps staff really engaged. If you're just standing in front of them in a classroom setting, kind of spewing the information out, you're going to lose their engagement within about 10 minutes. And so we make our presentations very interactive, very fun, and it does create lots of great interactions and conversation. And I would encourage you, don't be afraid to take chances during your presentations. There's things that Michelle and I have done that we thought would be a huge success that ended up being a dud, and we've learned from it. But don't be afraid to put yourself out there and take a chance on a video or an activity. If it fails, you learn from it, and then you can move on from it in the future. And then lastly, we talk a lot about this, is have fun with it, generate excitement. It can be extremely contagious and something that others will beg for if you continue to keep it on the forefront and show the positive impacts it can have for our patients and staff.
And we came up with an IRL TeamSTEPPS motto: one team, one goal, exceptional patient care. And so we make sure that we have this hanging so our patients can see it and our staff can see it.
Kip and Michelle, thank you so much for your presentation. I really feel that, that excitement that you're talking about generating is something that really comes through, and it's obviously something that's being very successful for you at Iowa River Landing. I look forward to hearing from you on the next webinar about sustainment, and I'd like to thank you again for coming through and doing this today.
Yeah, thanks a lot for having us, Chris.
All right, everybody, this concludes this webinar of the TeamSTEPPS for Office-Based Care online course. We hope we'll have you on another webinar in the future as you are fulfilling your requirements to becoming master trainers. Thank you and have a good day.